people who have been on flights. What's your advice to them?
So, I think the flying is one part of the travel to think about. I think there are measures in place that can really reduce the risk of transmission during flights. So, wearing a mask and actually like a fairly protective mask during flights is a wise idea to reduce risk. I think, looking at the bigger picture, there's a little bit more concern even about what happens after the flight. So you arrive at your destination, you're going to a gathering, masks are coming off, and that's actually where, I think the risk for spread is even higher. But during the flight itself, now we have mask mandates. Everyone's, wearing masks, and that really does provide some protection. Plus, the ventilation on the flights is quite good as well. So I think, we have to be thinking about the entirety of the picture, not just the flight, but really be attentive to what happens after the flight.
Now, many people who are trying to see family are also looking to get a COVID test first, and people are having a hard time getting appointments. They can't get in, they can't get a test. From your perspective, why are we seeing this, and when does that improve?
Yeah, no, I think that's a really good point. There's a huge demand for testing. We're seeing it here at UConn and across the state. People wanting to get tested before the holidays. I know the state's really putting in effort to try to expand testing. Here at UConn Health, we're expanding our hours for testing, but the demand is really high. So, I think, getting tested before a group gathering, particularly if there's going to be vulnerable people at the gathering or people who may not be vaccinated, is a wise idea. Trying to get into one of those testing sites is key. If not, there are rapid antigen tests out there that are becoming increasingly available. So that's another option too, in order to get tested and have that extra layer of protection going into a gathering.
I'm going to wrap right now because I'm being told we're out of time. But real quick, the at-home test that you can get at like Walgreens, obviously you need to research the test that you're getting. But if you can't get a test, are those ones okay? I mean, I was reading like one of them was 85% accurate, which is, decent. It's not awful.
Yeah, I think they're not as sensitive as the PCR tests that are done through other testing mechanisms. But, if the option of getting a rapid test or no test, the rapid test can be helpful. But just, take that with a grain of salt, recognizing that it's not foolproof. And still have to be mindful of the possibility that one could be infectious. And if you're really concerned about who you're with, take in extra layers of precautions.
All right, Dr. David Banach with UConn Health. Thank you so much.
Thanks for having me on.